Hi everybody, this is a video about treating mycoplasma. Just before I jump into the crux of the video here, if you don't mind taking a quick second to like or share or subscribe or comment on this video, even just a quick little thanks for the content or nice video or anything, just a quick little comment be appreciated. Just helps to build my channel and just gets me exposed to more folks out there who might benefit from watching these videos too. So thanks for taking a second to do that. Someone posted a question on one of my other videos asking about how mycoplasma can be treated, how long it takes to treat it. So as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. I was thinking about it, and I think I've posted a video about this before, but if I did, it was a while ago, and I just couldn't be bothered to go searching through the myriad videos that I've created before. So when it comes to working with mycoplasma with my patients, and I'm assuming that the question is around systemic mycoplasma, not specifically like just affecting the lungs or just affecting the urogenital tract. So if I'm wrong in that interpretation or that assumption, and the person asking the question wants me to speak to those areas, I'm happy to do that. But I'm assuming systemic mycoplasma, so it's causing fatigue, joint pain, brain fog, maybe certain neurological symptoms, things like that. It may be with some respiratory issues, maybe with some urogenital issues too. But let's just assume kind of systemic mycoplasma. So generally the tools that I use in my practice with my patients would include using systemic antimicrobial herbs. My favorite herbs to use would basically be the herbs that were popularized by the late to great Stephen Buhner, just a fantastic herbalist. He just passed away within the past few months, but just really contributed a whole lot to the world of complex chronic illness as it relates to systemic infections. Really opened our eyes to a lot of herbs that were otherwise just not very well known until he popularized them. So some of my favorite herbs to use when it comes to treating mycoplasma include an herb called Cryptolepis. There's another one called Isatis. There's another one called Alcornia, and another one called Sida. So those would be some of my top recommendations. But to be frank, I usually will throw in cat's claw, Japanese knotweed, Chinese skullcap as well, like just for good measure. I like to get a nice blanketing of systemic antimicrobial herbs dosed at a fairly robust dosage, usually in an herbal tincture form. I know there's oftentimes questions around like, what are the dosages? What are the exact protocols? And unfortunately that would be construed as medical advice, and I can't post dosages or specific treatment protocols. Unfortunately, you have to talk to your clinician about that. So I'm sorry I can't give more information than that. But using fairly robust dosages of those tincture forms of herbs would be kind of the foundation of an antimycoplasma treatment in my practice, because I want to make sure that we're, of course, killing off the bacteria. I would oftentimes consider bringing in some low-dose immunotherapy that's specific for mycoplasma to help reshift the immune system dysregulation that mycoplasma can induce. So mycoplasma, like Lyme, like Borrelia burgdorferi, like Bartonella, like Babesia, like Ehrlichia, like Anaplasma, these microbes are very good at shifting the immune system into this unproductive inflammatory mode, and by default shifting it out of a savvy microorganism killing mode. So it works much to the advantage of the bacteria, much to the disadvantage of the host, i.e. the poor beleaguered patient. So low-dose immunotherapy, as best we can tell, works to reverse that process. And so beyond that, I may, depending on the patient and their history, I might work with some things to help kind of boost their immune system integrity. So we might want to work with intravenous ozone therapy if they can access that. We might work with NAC. We might work with quercetin. We might work with some things to help enhance their immunoglobulin levels, like bovine colostrum, or I know some, not in Canada, we can't easily access it here, but there's a serum IgG that can be so a non-dairy source. So we might work with some of things like that. And then we always, with any type of systemic infection, chronic infection, we want to think about basically damage control, working to help heal up the damage that's been done to, maybe not damage control, that's the other stuff. We want to work at healing up the damage that's been done. So we want to look at repair work, and at what phase of the game we bring that into the protocol. Kind of, there's a bit of an art form to figuring that out, but generally we want the crux of that is focusing on supporting the mitochondria so the cells can actually start making energy again, start basically systems in the body can start working properly again. And in my world, that's using comprehensive mitochondrial support. There's a couple of products that I recommend to comprehensively support the mitochondria. And just as a little plug for my Overcoming Chronic Illness course, of which you can get the first 2 modules for free if you sign up for my newsletter, which is available in the description below or in my link tree. If you're watching this on Instagram, just go to my profile and click on the link tree there. But one of the first 2 modules is all about mitochondrial dysfunction, and I go into a lot of detail about all that in there, and it's available absolutely for free to folks who are interested in accessing that. But making sure that those are being comprehensively supported, because sometimes, we kill off the infection, we immunomodulate, we do all this great stuff, but the person's still left feeling really tired, really depleted, and we need to rebuild those mitochondria, get them back on track, or kind of breathe life back into those mitochondria so the patient can have life breathe back into them, because mitochondria make all of the energy for our cells. So that's the overall approach in terms of how I work with my patients who are dealing with mycoplasma. And in terms of timeline, it's everybody's least favorite answer, but it depends. It just really depends on the chronicity of the symptoms, how compliant the patient's being, how responsive their body is to the treatment. Do they have other pathologies going on at the same time? Are there other infections? Is there mold toxicity? Are there elevated heavy metals? Are they not methylating well? Is there mast cell activation? Are there chronic digestive issues like SIBO or LIBO or things like that? So it really depends. But if there was just kind of are there biofilms, which is another variable. But if it was just a straight up kind of like easy peasy open and shut mycoplasma case, might be somewhere between like 1 to 6 months, give or take. And again, that's quite a range, but it would just depend on a number of those factors. If there's other more complicating factors afoot, then it could be longer than that, depending on a bunch of different factors. So thank you for the question. If there are any outstanding questions on this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.